I think a lot of children and families are experiencing quite a bit of distrust in the healthcare system, and there's a lot of disinformation and misinformation out there. One thing that I've experienced is a family that recently came in and had an experience in the emergency room where they just didn't feel heard. They actually felt judged, and that led to some significant problems where they left the emergency room early and didn't get the care that they needed. So when they came to my office for a follow-up visit, I recognized that I really needed to build rapport with this family. And so I sat down with them, I deeply listened to them, and they started to slowly trust me and were able to tell me some information about their past experiences that was able to allow me to help them move forward with that. And we've since met many times, and we've had really great rapport, and I think it's that longitudinal relationship that a pediatrician has with a family that we are very privileged to be able to have that has really allowed for us to kind of move forward and to be able to help this family. So that human connection is so important. So when we are treating children, I really think about the whole child approach. So thinking about the child within the context of their family, their school, their community, and really recognizing that there's a lot of things in their environment that they can't control. So I think that if we can create the environment for children to be able to thrive, have policies that work for child health, make sure children feel safe and connected and secure in their environment, I think that will be so important for them to be able to grow and learn and play and work and really thrive and flourish.